While debate rages in Washington over funding the Affordable Care Act, final preparations are being made for the rollout of a key part of the law, the online healthcare exchange. There's been a lot of confusion and misinformation surrounding the healthcare marketplace as open enrollment nears on October 1st. This week, Oklahoma Watch hosted a forum to discuss the law and whether the state would take up a report's recommendation to accept federal dollars for Medicaid expansion.
Talk to any hospital executive in this town or this state. Having someone who's uninsured show up and needs to be admitted to their hospital is a huge expense to the hospital, which gets shifted onto the taxpayer. We got a federal grant to hire several navigators who are people who will help anyone, whether they utilize our providers or not, help them navigate the exchanges, which would go live in a week, which are marketplaces. I describe it as sort of an Amazon.com type of site where people can shop and compare plans. So I found out today that yesterday at our largest community health center, Straka Terrace, which is a 40,000 square foot family practice center on the south side of Oklahoma City, an individual came in yesterday asking about the exchanges, and our front office person explained that they're not available to enroll yet, that our navigators will be available in about a week. And the word I got was that this individual started to cry and said that he and his wife have such mounting medical bills that they really are anxious for it to get going. He was more upset that the fact that the plans would not go into effect until January 1. He could wait a week to enroll, but he was anticipating that the plan started October 1st. So that's just one anecdote of, obviously, there are some people out there that are anxious to sort of wrestle with it and see what sort of access that they may get that they previously don't have. So.
The governor has been very, very clear. She wants to make sure that people have access to accurate information. So pulling together the health and human services agencies, we talked about those resources that are available. We want to make sure that those agencies, when they receive that question, they actually are putting people in touch who have the latest up-to-date information. So there's a website, healthcare.gov, which is a resource that everyone should be familiar with. That'll put you right there. There's an 800 number, 1-800-319-2596, that also will connect people to that information. Those are two of the resources that we're pushing out. We want to make sure that people go straight to the accurate federal resources to get that.
October 1st is when you can begin enrolling. That does not mean coverage starts then. Coverage starts in January. So that is a good point. There's not really a need to rush right in. But generally, these are private insurance plans. These are not government plans. So I think the three providers so far in Oklahoma that have posted, Blue Cross.
I think there are 5 altogether, two HMOs and 3 other carriers.
There are carriers. And so there will be all different types, generally what they consider bronze, silver, and gold level type of plans. The bronze would be more sort of generally what we're used to as sort of the more high deductible catastrophic type of coverage, so won't cover a lot of costs for doctor's visits and pharmaceuticals, but if something really bad happens, most of your costs at the hospital will be covered all the way up to the other end of the spectrum. The one thing that I think is very important but that doesn't get sort of reported a lot is for people at different income levels who go to the exchange to purchase a plan, there are tax credits from the federal government that are available that they are eligible for that will reduce the monthly premium.
I mean, are we going to be sitting here next year saying that, well, the governor was busy trying to get the extension renewed on Insure Oklahoma, so we didn't have time to focus on implementing or rejecting the Levitt Partners recommendations?
What we know is if we stay on this trajectory, we will bankrupt this country. In response to the small business person we heard back there, if we don't bend that cost curve, we'll see more and more that's required on the part of small businesses. When you hear General Motors talking about we're spending more on health care than we're spending in the steel that we put in our cars, that system is broken. It is fundamentally broken. So we can't simply expand that system. We need to do those things that Senator Rice talked about in terms of finding models that actually work, that address, improve health care outcomes, and bring down those costs. I think that there are some of those elements in the Levitt plan, and those are being explored.